HRV is heart rate variability. It's one of the things that I ask my patients about and ask them to keep track of. So HRV is a measure of the beat-to-beat variation in your pulse. So like if you're looking at pulse rate is the number of heartbeats over typically a minute, and the normal person is 60 to 100. Typically, the more cardiovascularly fit you are, the lower resting pulse rate you're going to have. So a lot of people think HRV is something to do with your pulse rate, and it's related. But HRV is again it's the change in the distance from one beat to the next. So if you look at an EKG and you've got your little waves, you measure the distance from one wave to the next wave at the same spot. That distance typically would change. A lot of people think it should be just steady and constant, but it should change. And actually, the more it fluctuates, typically the better autonomic nervous system sort of you have. So that beat-to-beat difference in a healthy autonomic nervous system state is regulated by your vagus nerve, and when it's healthy, that variation will fluctuate more. It'll be a greater fluctuation when your nervous system is healthy, typically when you're not stressed, things like that. And so one of the things I have people do, a lot of modern health detectors, health watches will track HRV. Your Apple Watch, your Garmin, some of those will track HRV. So what I'll have people do is sleep with their watch on for a couple nights. There's rings and other things that do it too, and we'll find that number. And generally, the higher that number, the better someone feels, and it's a bit of a objective measure of stress. Generally, if we're in the 20s or 30s, we're going to want to get that up 50s or 60s. It just naturally does decline a little bit with age. So HRV is really an important measure. For me, it's kind of almost like a new vital sign that I'll take. It's hard to do it like in the clinic because overnight resting overnight HRV is good, but I will often ask my patients to monitor their HRV and report back to me on that.